Our group has chosen to present on advocating for reduced productivity standards to limit the negative impacts these policies have on service delivery. Our group includes Madeline, Andrea, Aaron Hells, and Josie. What are productivity standards? Productivity standards are the ratio between input and output volumes in the workplace. For clinicians, this would be how much billable time is spent with the patient during a clinician's workday. While these standards are important to measure outcomes across all settings, these measures do not include non-billable services necessary to provide the proper level of patient care. Some of these services that are not billable could include interprofessional collaboration with the staff on the patient's team, such as the doctor, the nurse, the dietitian, as well as documentation time, the time spent gathering materials, and going to the patient's room. It has been reported by speech pathologists and audiologists in many settings that clinicians are faced with ethical dilemmas when attempting to reach the high productivity standards set by their employers, which will lead to improper patient care.
This graph illustrates the productivity percentages that are required by type of facility. For example, the general medical military VA setting typically requires about 90% productivity. Home health requires a little bit more than 75% productivity. Outpatient clinic requires 75%. Pediatric hospital requires about 70% productivity. The rehab hospital setting requires a little bit more than 75%, so between 75 and 80% productivity, and the skilled nursing facility requires about 80% productivity.
Healthcare has shifted from a provider-centered payment model to a patient-centered model, so there's a demand for reimbursement. The demand causes healthcare systems to increase cost and productivity to increase efficiency. Skilled nursing facilities are reimbursed through Medicare Part A and Part B, and although the stipulations are set in place in which they require clinicians to treat patients who have the potential to restore previous abilities and have a certain condition where they're going to improve and show improvements after treatment, the stipulations are not being followed because SLPs are still reporting to ASHA that they're having to provide treatment to patients who are not showing improvement and who are not appropriate for the treatment at the time, even if it's only treating patients for one day.
So how do productivity standards affect clinicians? High productivity standards result in potential burnout and less quality in the services provided. And in an attempt to be more productive, clinicians may be forced to complete non-billable activities during their own personal time. As such, clinicians feel pressure to violate ASHA standards and in turn must report their concerns to their supervisors. How do productivity standards affect patients? Patients may receive less quality services due to possible fatigue on behalf of their treating SLP. Patients may receive group or concurrent treatment rather than individual services, impacting their progress towards goals. In addition, patients may feel more like a number rather than an individual based on the quality of care provided. And patients who are not appropriate for treatment may be treated to reach productivity quotas.
Advocacy plan. For our plan, it is spread out through 8 weeks of work. Week 1 through 3, we will be developing an action plan. By the end of week 1, we will create a list and visit employment facilities. By the end of week 2, a survey will be conducted with the participants of the various employments from that list created. By the end of week 3, the goals are to be created with the deadlines. Week 4 through 5 will be establishing an advocacy network. So by the end of week 4, the changing factors will be identified. In week 5, we'll be collecting and calculating those surveys. We will create and post on all social medias and try to gain a following. Week 6 through 8, we'll be working with the legislator. So by the end of week 6, we should create an ASHA Take Action account and email the legislators. By the end of week 7, we should follow up with an email to confirm the appointment with that legislator. And in week 8, we will have a meeting with the legislators.
The success story I found is from a speech-language pathologist named Marisha, who spoke at SLP Summit, sharing her tips on how she advocated for herself to decrease her productivity. Some of the things that she recommended to do to help decrease your productivity so that you are more efficient and skilled as a therapist was to speak up for yourself. So what she did was she communicated with her supervisor, her director, and communicated that her productivity was too high for her to handle all the things that she needed to do. She also recommended to not be afraid to say no to things that you are unable to handle. So taking on, a higher caseload or extra documentation, extra side work. Some of those things, might be too much to handle. So she recommended to not be afraid to say no. Request assistance if necessary. So either suggesting that another SLP be hired or an SLPA to help alleviate some of the extra workload. Document workload on a calendar. She recommended using the ASHA workload calculator so that it can be viewed by a supervisor or a case manager or director of therapy, so that they can also view, how many hours you are documenting. Add a therapy schedule, block for evaluations, and schedule time for paperwork. And she recommended also doing this in an Outlook calendar, so that way the calendar can also be shared with a supervisor or a director of therapy. Document overtime or any work-related tasks that are being completed outside of work. So any work or reports that she was completing outside of her work hours on her own personal time, she recommended to document that so that way, directors and supervisors can see that they're taking work home and they need more time in the workplace to complete these tasks. Present a solution when addressing a problem. So if you're coming to a director or supervisor with a problem, she recommended to also present them with some solutions on how to solve the problem. She also recommended not to be afraid to go higher up the chain if needing more support for productivity. So in some cases, there's supervisors or directors of therapies that will kind of overlook your request to decrease your productivity. And she recommended, it's okay to go higher up the chain to speak up for yourself and advocate.